Hey Johnny, your GT Physiotherapy, and just quick 180 for better health today. It's on back pain, chronic low back pain, and how we successfully treat it in the clinic, and what are the most important aspects for you to learn as a patient. Okay, so back pain, there are many different forms of back pain, but a lot of the time we can improve back pain by strengthening up the muscles that support the spine and improving the way that your body moves. Okay, and whenever we talk about improving the way the body moves, a lot of the time we're teaching the body how to move well at the hip joint, okay? And moving well at the hip joint is really important because it allows you to maintain your lumbopelvic stability, okay? What I mean by that is that you don't tend to start a movement at your lower back, okay? Or initiate a movement at your lower back, and you're not initiating a movement at the knee joint, okay? So what we want is that you're able to keep basically the movement to start at the hip joint and maintain your lumbopelvic stability throughout that movement, okay? What we look at most closely are closed chain exercises. So exercises where both feet are in contact with the ground, they're more functional, okay? Examples would be squats, front squats, back squats, single leg squats, the likes of maybe starting off with kind of initiating the movement in a modified deadlift position, or different aspects like that. So one of the little tricks I'm going to teach you to try and initiate movement at the hip joint is something that we use with patients. And what you're going to do is with one hand you're going to locate the breastbone, okay, and the other hand you're going to locate the pubic bone, okay. And what that allows you to do is get a reference point. So the breastbone through the ribs is going to have an attachment point onto the thoracic spine or the mid-back, okay. The pubic bone allows you to feel what's happening at the pelvis, okay? So if you imagine, if you have one hand here and one hand that attaches onto an aspect of the mid-back here, when the spine bends, those 2 points come closer together. When the spine extends, those 2 points become further apart, okay? I'll give you an example here. So I talked earlier about initiating movement at the hip and not the back. When I've got one hand on the pubic bone, one hand on the breastbone, and I'm starting a squat, for example, and these 2 points move further apart, then what we're actually doing is moving from the spine as opposed to moving from the hip joint, okay? If I tend to start a squat and I get into this position and we're flexing through the lumbar spine, what happens is the 2 points come closer together. So what you want to teach patients to do, and what you want to be learning to do back home, is learn to initiate movement at the hip joint while these 2 points on the spine stay the same distance apart. Okay, so that's kind of your bread and butter, and generally that's where we would start when we're teaching someone how to move well from the hip to protect the back. Okay, once you can learn to control that movement really well, what you do is very slowly then you load up the weight a tiny bit and strengthen the muscles in the lower back while maintaining this. At any stage, if you lose the lumbopelvic stability, okay, or you're not moving well through the hip joint, then we have to come back to the very start and generally make sure that you're getting that movement perfected before starting to load up the spine too much. Okay, thank you.